Good afternoon. My name is Justin Cookow and I'm the Head of Business Continuity at the University of Surrey, and I'm joined by Dr. Catherine Henderson, who is a consultant in emergency medicine at St Thomas's Hospital in London. We're going to talk to you about the WannaCry global ransomware incident, which took place on the 12th of May 2017. And the case study is going to draw on formal reports from the Department of Health and Social Care, from the National Audit Office, but also from hacker sites, from malware technology sites, and critically, it's going to draw on the experience of a senior clinician in a major trauma centre who experienced firsthand what it's like to be involved in a cyber major incident. Data is the new oil. It's the source of wealth and value creation. But data is also the new asbestos. If you don't know where your data is, if you don't know who controls access to it, and if you don't have a clear process by which you can manage data that you no longer need, then just like asbestos, data will have a toxic legacy. So the objectives of this session are to review the current cyber risks in Asia and to look at some global trends and talk you through some of the key forms of cyber attack that we need to be prepared for. To understand the clinical impact of the WannaCry cyber incident and to explore the key lessons that we've learnt in the UK and to review the learning that might be drawn out of that for Hong Kong hospitals. I'm also going to consider how to build effective operational strategies for recovery from cyber incidents, working with IT leadership. So in the UK, 3 years ago, we set up a UK-wide National Cyber Security Centre. And their annual review of 2017 made very clear that it's not a case of if there will be another cyber attack, but when the next cyber attack will strike the health and social care system. And the Chief Information Officer, a chap named William Smart, quite rightly says that it's critical that we can maintain trust and confidence in the services we deliver as information technology becomes ever more integral to the health and social care system. We absolutely know that it will happen, so we need to be ready. We have growing demand from an ageing and growing population, growing demand on healthcare, and growing dependencies on IT. This issue is perhaps the single biggest threat to patient safety at the moment. We know, ultimately, that we will not defeat the cyber threat, but we can do lots to make ourselves a much harder target. With WannaCry, the UK did not have a ransomware playbook. We quite simply weren't ready, and data governance and information security had not evolved at the same speed as technology, which left both investment gaps and vulnerabilities. So it was a massive wake-up call for the UK government and for the Department of Health and Social Care. So we're going to talk through the trends in cyber and the reasons that Asia in particular is viewed by experts as being at heightened risk, before then looking at the impacts of WannaCry from the perspectives of a senior clinician. So according to the Marsh & McLennan Cyber Handbook of earlier this year, Asia is 80% more likely to be targeted by hackers than other parts of the world. And that's partly because of the growing speed and scope of digital transformation in APAC countries. By 2020, Asia will account for 60% of the 4.2 billion internet users in the world. and also because of the expanding sources of vulnerability from the Internet of Things connectivity and mobile devices. Of the 20 billion connected devices by 2020, APAC countries will account for 8.6 billion of them. And also because Asia is seen to have weaker cyber risk mitigation. And that's at a number of levels. It's firstly in terms of education and awareness, a huge new level of internet users, booming exponentially, does not have cybersecurity at the forefront of their minds. But also because investment is significantly lower than North American countries. And that where cyber skills gaps exist, hospitals and other sectors of the economy in Asia are finding it incredibly difficult to attract and to retain cyber talent. In Hong Kong, the Personal Data Ordinance came into effect in 1995, but it's widely viewed that compliance to that has been poor to date, and the incidents aren't reported as quickly and as efficiently as they might be. And that, as we'll see, has significant implications. So cyber risk is entering a new phase, and we have high levels of sophistication from what is now, quite frankly, an illicit, mature, global business sector with nation-state actors, in which space there's propagating, there's powerful propagating, self-propagating malware. Ransomware attacks have spiked significantly with major ripple effects. And the bulk of activity in terms of cyber is actually from script kiddies or noobs, people who are going after low-hanging fruit, and they're causing not very much of the damage, as you'll see from the two triangles. However, we've also got criminal groups, criminal consortia, who do this as a professional job. So there is one famous group called the Russian Business Network that's known by its internet service provider, which essentially attracts computer science graduates which work full-time, 40 to 60-hour weeks, day in, day out, working on trying to find high-value targets and to break into them. So banks and other organizations. And these hacker groups, whilst they account for only 20% of the threat, they're causing about 80% of the damage. And then we have nation-state activity. So Korea, North Korea, famously attacked Sony Pictures when they were looking to release the film The Dictator, which they took umbrage with. Russia has been accused of influencing the elections in the United States and possibly the Brexit vote in the UK. And as you may have seen in the press recently, they were also, looks like they were caught red-handed trying to hack into the Office for the Prevention of Chemical Warfare. So there are other nation-state actors too. Iran was recently identified as the source behind an attack impacting 100 universities worldwide in an attempt to steal intellectual property. And cyber is now becoming part of international military warfare doctrine. Quite simply, it's a lot easier to launch a botnet attack on a nation that you don't like very much than it is to invest in expensive conventional weapons without achieving the same impact. We're also seeing high and growing levels of IT dependency across the board. So systems, apps, software, and the growth in connectivity between digital and physical devices is huge. Nearly every hospital now uses some form of electronic patient record system. But there are also huge growth in the data sets that are available to support personalized treatment based on genomics, using real-world data from patients wearing portable devices. And the acceleration of the connection of the Internet of Things, so your central heating systems, your air conditioning, portable medical devices, your Wi-Fi router, your security camera at home, all of those things that connect to the Internet massively expand the surface attack area. And many of these external devices to your core systems are actually connected and therefore a route in to attack your main systems. Okay? So what we are seeing in this new phase is a significant and rising importance of coordination amongst institutions. There is even discussion of creating a Geneva Convention for cyber warfare, because the ramifications of a unmitigated, poorly thought through set of cyber attacks could actually be catastrophic for the way that we act and deliver services in the world. And it's critically important as part of that rising importance of coordination that incidents are quickly reported. If incidents are buried, then other actors are not able to respond to the threat. And so in the UK, we've seen a huge increase in legislation around data security, with the General Data Protection Regulation, GDPR, coming into force earlier this year. And in that, there is now a legal requirement for anybody who suffers a data breach to report it within 72 hours, otherwise face a fine of 20 million euros or 4% of global turnover. So there's now a huge incentive for organisations to report cyber incidents, because what that does is it enables all other players in the game to take prompt mitigating action. So cyber, what do they want and who is at risk? So the vast majority of activity is criminal and it's for financial gain. There's also a degree of that script kiddie and noob level that are simply after personal satisfaction. If they were able to attack the Department of Justice and change its web page, then they've had a good day in their bedroom. But to date, we have not yet seen cyber terrorism, but it's definitely something that we can foresee, and it's something for which we need to be ready to respond. The Hatmageddon website showed that in January, 10% of cyber targets were human health and social work activities. 10%. And the key areas of attack were these. So phishing, spear phishing and social engineering, malware, ransomware, denial of service or distributed denial of service attacks, and out-of-date software. And I'll go on to describe each of those very briefly so we're clear about what we're talking about. And the key impacts of cyber attacks have been IT and telephony outages, reputational damage to company websites in particular that have been hacked, so banks, airlines and others that have hit the news, toy makers, a loss of profits, supply chain disruption and physical security concerns. But what hasn't made it onto this list, which was only published a couple of months ago, is the rise in crypto hacking. So this is where the processing power of your devices is taken over by cyber criminals, who then use the processing power to authorize or mine cryptocurrencies such as Bitcoin. And there's huge value in doing this. In fact, it's proving to be much more lucrative to them than something like ransomware, which has relatively low returns. Okay? But the speed of evolution in cyber is really quite frightening. So this new area hasn't even made it into the reporting as yet. So we know that our personal data is incredibly valuable. And you'll hopefully be able to relate to this data breach in Hong Kong of VTech, which highlighted the importance of protecting the data, not just for adults, but also for children. So before these children have even reached the age where they're interacting with the world of IT, their personal data has been stolen. Personal data is, of course, one of the key things that we all use to authenticate our access to systems. Yeah? So your date of birth, your mother's maiden name, your favourite pet. Well, in this VTech hack, more than 200,000 children living in Hong Kong had their names, email addresses, passwords, home addresses of parents, first names, genders, and birthdays stolen from them. VTech could quite simply have protected that data by obscuring it or making sure that it couldn't be accessed. Neither of those things were done. And this information is incredibly valuable to criminals. They use it to access our bank accounts. They use it to access our email and put themselves as man in the middle so that they can perhaps impersonate us and impersonate key financial transactions that we're doing, perhaps when we're buying a house or when we're paying builders, yeah, and have that money diverted directly to them. But they also use it to bypass security and take over the processing power of our devices. So let's have a quick look at the key types of attack. Phishing or social engineering. So people are quite simply the weakest link in all of our systems. And 90% of cyber incidents are a result of human error. Okay? Phishing is now the #1 vehicle for the delivery of ransomware and malware. And predominantly this happens in the form of email attachments that you'll click on, and that will then embed malware onto your device. So you'll get emails purporting to be from your payroll department, purporting to be from your bank, purporting to be from your parcel delivery company, or maybe it's just a cute picture of some cats which intrigue your interest during your lunch break and encourage you to click on them. And opening those email attachments then unleashes malware onto your account. Another form of phishing is a mechanism whereby they'll encourage you to fill in your details. So they'll pretend to be from your bank, and you'll provide all of your account information to those cyber criminals. Social engineering is another element of this. We increasingly live our lives online. No doubt many of you have got LinkedIn accounts, many of you have got Facebook accounts. Well, you'll be disappointed to know that both of those organisations have been hacked repeatedly and have lost millions of personal data records. So if you haven't changed your password on Facebook or LinkedIn recently, I strongly encourage you to do so. But the information found on those websites helps cybercriminals fill in the gaps. So they can take the fact that you liked a holiday in Macau and that your pet is called Tommy, and they can add all this information together to fill in the gaps that are needed to authenticate you as a user. Another element is spear phishing. So this is when a senior executive in an organisation, often the chief financial officer, sends out an email purporting to be from them. So they've been hacked, their email account has been hacked, and you'll get an email from the chief financial officer saying, I need you to transfer £100,000 to this account immediately. I'm not in the office and I'm not available on my phone because I'm at a conference. Do it right now, please. And that has led to lots of people making transactions in error to the cyber criminals' gain. It's worth noting that cyber criminals talk about people as wetware. So you have hardware, software, and us, the wetware. And we're that vulnerable bit in the middle where if we're not careful with how we manage information, we break the information security system. And there's a fantastic website, Catherine, if you could just flip over that page, called haveibeenpawned.com, which holds a master list of all known email addresses that have been subject to a hack and whose personal information is available on the web. So if you put haveibeenpawned.com into your phone and put in your email, I suspect you will find, if you have LinkedIn and Facebook accounts, that your email addresses are known to cyber criminals. So if you haven't yet changed your password, again, I strongly recommend you to do so. We also have malware. So malware is software which is specifically designed to disrupt, damage, or gain unauthorized access to a computer system. So this example of the Singapore Health Authority, it was a deliberate, targeted, well-planned attack. It was aimed at getting the personal medical information of the Prime Minister in order to provide political scandal, intrigue around them. But the consequences of that were that Singapore Health had to temporarily ban all staff from accessing the internet on all 28,000 work computers. Okay. We then have DDoS, or distributed denial of service attacks. So this is where Internet of Things connected devices, known as bots, are taken over, and their processing power is used to throw repeated pings at a server in order to knock it over. Okay? And in knocking it over, it provides cyber criminals the opportunity to embed malware onto that server, or to change the content of the web pages, or to steal data. So the Internet of Things harnesses the power of connected devices, and there's a long list of connected devices, and in a healthcare setting, obviously things like CT scanners and the likes. Famously, an example recently was of a casino in the United States of America where their fish tank environmental monitoring system was linked to their main computer through an Internet of Things connected device. The fish tank was an IoT. And as a result, it provided a backdoor into the main gambling website and main database of high rollers, and the cyber criminals managed to hack in via the fish tank into the main system and steal data and funds. So DDoS are used for a whole range of reasons. Political purposes, but also to cause reputational damage to companies that aren't liked by the hacker community. So hijacked devices are known as bots, as I say. So a botnet attack is from IoT devices. So if you haven't changed your default password on one of your Internet of Things connected devices, your wireless doorbell, your home Wi-Fi router, whereby the factory default may well be 0000, then you are providing hackers with an opportunity to break into your device, to take it over, to use it in a DDoS type attack. And it's worth noting that Hong Kong last year was the third most attacked country in Asia Pacific by DDoS. So we also have crimeware. So these really are unprecedented times. So if you don't know how to do this stuff yourself, well, you can rent these services on the dark web. So you can buy malware as a service, DDoS as a service, phishing as a service, hacking as a service. And of course, then we have out-of-date software, legacy systems, technical failure, and human error. So in this particular example, a prestigious London university, Russell Group University, had poor backup regimes in place. And even though this was not a cyber incident, what it led to was £8 million worth of research data being lost because the backup tapes had not been tested, and many of them failed. So let's move on to WannaCry. It's Friday the 12th of May, 2017. WannaCry emerges onto the cyber world and hits more than 300,000 computers in 150 countries in less than 72 hours. Many organizations worldwide, so Chinese universities, Telefonica in Spain, Russia's Interior Ministry, and global firms of high prestige like FedEx, Nissan and Renault were affected by WannaCry. The NHS in England was not a target of WannaCry, but because it was unprepared, it was heavily affected. The NHS in England sees over 1 million patients every 24 hours across about 236 trusts, so that's acute, specialist, community and ambulance trusts, and there are about 7,500 GP practices. WannaCry actively scans the internet for users who don't have the latest security updates in place to block malicious internet traffic. There's no need to click on anything. It simply installs itself and then locks down the computer and asks for a payment to recover your data. So in advance of WannaCry, the NHS had put a number of things in place. It had launched an information governance toolkit which sets standards for data security management, but it was based on self-assessment and there was no mechanism to check what trusts had actually done. NHS Digital had issued or developed a mechanism called CareCert, which identifies threats, sends out alerts, and issues patches and updates to systems to bring them up to date. Again, there was no assurance that patches had actually been implemented. So in advance of WannaCry, on the 25th of April, a patch to stop this problem had been issued to all NHS organisations in the UK. But as we're about to see, not all of them had got round to implementing it. So that's what the global extent of WannaCry looked like. Originally, security companies claimed that the breach was as a result of malicious spam campaign, but WannaCry wasn't distributed by email. IT forensics analysis suggests that the WannaCry infections used a leak from the NSA, the National Security Authority of the United States, to use a compromise using something called Eternal Blue software to exploit underlying vulnerabilities in public-facing message server ports. And that was to reach a known Microsoft Windows vulnerability for which a patch existed. So the code is then capable of targeting vulnerable machines using their IP address, and it works to directly target the server message block port. So that's port 445, the connected network of devices. And by using that backdoor, WannaCry could get in to the machine, to the vulnerable machines, and alter the user mode process. And in doing so, they were then able to bypass the authentication control and take over that device. So the attack uses a known Microsoft Windows vulnerability. It's not an attack on unsupported software. Most trusts in England were running supported but unpatched Microsoft 7 operating system. Unsupported Microsoft XP devices were also affected, but they were in the minority and they were often provided by third-party suppliers, and often third-party suppliers of diagnostic equipment. The NHS uses a British Telecom provided N3 national broadband network to connect up all of those acute trusts, GP clinics, community care, ambulance trust, and the like. Okay? Better network firewalls would have prevented this attack. So let's have a little look at the timeline of WannaCry. So by late morning, the first trusts began to report problems. By 6 minutes past 1, NHS England's emergency preparedness, resilience and response teams were made aware of the attack. So 4 NHS trusts have been impacted at 6 minutes past 1. By 4 o'clock in the afternoon, 16 trusts have been affected and a major incident was declared. Critically, the lead organisation was only agreed nearly 3 hours later. And the NHS's response then went into 3 phases. Firstly, securing the emergency care pathway. during the Friday through to the Sunday. Secondly, assuring that the primary care was operationally stable. And thirdly, ongoing remediation and wider system access and antivirus update. On the evening of that first day, a cyber expert happens to discover the kill switch for WannaCry. If that person, operating entirely independently of the NHS, hadn't found the kill switch and activated it, the impact of WannaCry could have been and would have been much greater. Essentially, WannaCry was on an unregistered domain and was sending back a ping to make sure that it could continue to get operating instructions. And this cyber expert registered the domain. And in doing so, stopped WannaCry receiving instructions, so it stopped propagating. Just goes to show how unsophisticated this WannaCry attack was. And we've already seen the level of damage that it caused. So this was happening on the Friday. On the Saturday, the 13th of May, we still had 5 acute trusts operating some degree of diverts from their accident and emergencies. They were using mutual aid. The system pressure as a result was huge. Many trusts, as we'll see, had diagnostic services, so MRI and CT scanners, affected. And communications, which normally happen in terms of incident management by email, were not available. So the impact of WannaCry was huge. In terms of trusts affected, approximately 80 of the 236 trusts in the UK, a third, were impacted by WannaCry. But there were lots of other trusts that were indirectly affected, either because they were seeing more patients or because they had decided to stop their link or their connection to N3 so they wouldn't get the malware, the ransomware introduced onto their IT systems, and in doing so, of course, they cut off the flow of information from other hospital trusts, therefore were unable to receive diagnostic test reports and all the other information that's required in order for them to process patients. It's getting quite scary at this point. And then, of course, there are trusts where systems were attempting to access WannaCry, but because the kill switch had been activated, that didn't actually end up loading onto their machines. Okay? So, in total, something in the order of 19,000 patient appointments were cancelled, including 139 urgent potential cancer patient appointments. Approximately 8% of GP practices were affected. The costs to date are estimated to be at about £92 million so far. And during this cyber attack, something in the order of 1,300 pieces of diagnostic equipment was impacted and unavailable. Okay. So we're going to hear now the testimony of a senior clinician working in another trust in the UK from Catherine, who's going to describe what it looked like on the front line when IT is not available.
So everyone realised that actually this was absolutely unprecedented. No one had had any experience of anything like this. So what I'm going to talk about is from a different trust from my own. But from my own point of view, Friday afternoon, when you're trying to get things set up for the weekend, is not the moment to realise that the NHS is under a massive cyber attack. And at that point, the very first that we knew about it at my own trust, we didn't know whether we were going to be affected or not, because no one was able to tell us what the actual problem was. So I spent a happy hour photocopying A&E cards so that we would have something to write on should the whole system go down. It then became apparent as the afternoon progressed that we were okay and that we weren't one of the trusts affected, and we never had any specific problem. But for the guys who did have a problem, what was it that was happening? One of the biggest trusts that was affected, in one of their satellite hospitals, it was realized that they were unable to get any of their X-ray images up. That was the first thing they realized. And then they started to get messages on their computer that actually said what WannaCry said, which was that they were now under attack from ransomware. So the icon came up on their computer and they realized that they could no longer do the things that they were expecting to do. Effectively, they were cut off from all their normal IT activities. So what do? You suddenly are in that position. You're a frontline clinician, you're looking at your computer screen and you suddenly realize that something is going on. You've got no experience of this. And they started to then get phone calls that was telling them to turn off their computers. That was the very first thing. So you're trying to get information, you're trying to carry on with patient care, and you're being told to physically just turn off everything in front of you, which seems such a basic and unlikely event, but that's basically what they needed to do. And they did that as quickly as they could, but you're going around trying to find all those computers in all sorts of parts of your department to turn them off, to try and stop this happening, not really knowing what is actually going on. Then there was a sort of conference call. Their IT system started, it became apparent from their IT people that there was a problem. And then they started to realize the scope of what they had lost. They had lost access to, it wasn't just imaging. They thought originally, oh, this was an imaging problem. But they no longer could do anything with their blood bank. They couldn't do blood tests. They couldn't track any patient information from the electronic patient records. Their email systems wasn't working. So they suddenly were in a very dramatic situation. They didn't know how big the issue was. They presumed everyone was involved, but it turned out that actually this particular trust was one of the biggest trusts involved with it. But they are a major trauma centre, and they're one of the biggest major trauma centres in London. So you've now got a major trauma centre that cannot cross-match blood, cannot take CT scans, cannot take plain radiography. So you've got a helicopter just about to land on your ceiling with a patient who might need your care, and you can't actually deliver care. So they very rapidly had to get themselves organised as to what they could and what they couldn't do, which actually meant having people at the front door saying to people, you're going to need to not come here. So they were physically needing to turn patients away from their door. They then had to get in touch with NHS England that controls all the hospitals to say, we've got to close our major trauma centre, we've got to close our stroke centre. We can no longer take those patients. And at this point, it's becoming apparent within the rest of the NHS that there is a big problem going on. So where are they going to take the patients that are involved in this problem? They were under pressure not to close things, because at this point the rest of the NHS didn't really understand how big a problem it was, and there was a huge reputational issue about not being able to continue with these services. And they managed to get their CT scanner up and running, but only so that they could actually see the CTs on the CT scanner, but they could not get things like blood bank up and running again. And they didn't have tracking systems for patients. So they had situations where they got a lot of medical students in, and if you look on a lot of the social media that was going on around that time, there was literally social media requests for this hospital's medical students to come in to act as runners for patients, because they needed to know where patients were. The children's department had barcode labels that they could use, but none of the scanners would read the barcodes. So they were needing to use the numbers, you know how tiny those little numbers are on the top of a barcode, to try and make sure that they knew where individual patients were in the system. But they couldn't do imaging, they couldn't do blood tests. And as I said, they were having to tell people to go away and say, we can't treat you. But they didn't really know where they were sending those patients to, because they didn't know at this stage the extent of which other units were functioning. And their whole sector, which was 3 large hospitals, were taken out completely by this. How long did it take them to recover? Well, it took them a long time to recover, and their reputational damage was pretty extreme. They had to cancel major surgery, and they had to cancel major surgery of patients who were already in a very pressured system. So there were patients who were being cancelled who already had been cancelled for rather more mundane reasons. But now this was of public interest, and so newspapers were all over them, and the media frenzy around what was happening. They had an aortic operation that they started and which they had to abort when they realised that they didn't have adequate blood supplies for doing that. They couldn't actually get blood transfusion back up and running. And it just made realisation that people didn't understand the interdependencies of the hospital, that they didn't understand that you could have one bit down, but actually that would affect huge numbers of other parts within the system. And if you tried to carry on, you were going to make things very, very difficult indeed. What it did do is highlight how difficult it was to communicate with staff. And they ended up with some very interesting conversations about WhatsApp, as to whether they would have secure groups from WhatsApp. And they used WhatsApp a lot, but that caused a lot of disquiet in IT security circles, that they were using WhatsApp to communicate. Email was out for weeks. They couldn't use their email systems to communicate. So this changed the organisation quite a lot. Again, if you go onto social media, there are a ridiculous number of frightfully jolly NHS comments about, we thank our wonderful staff for having worked so hard and coming in at the weekend and getting everything sorted. And you see that for numerous hospitals around the UK, posing for pictures, group pictures of how well we did coping. Given that it was not administering a patch in the first place, you kind of think, all that effort, all that work, all that having to get people literally in at the weekend, because that's what they did, seems absolutely crazy. But a very relatively simple ransomware attack absolutely paralysed the system. So back to what happened next.
So clearly when something this horrific happens to your national health system, you can quite rightly expect there to be a huge level of scrutiny and lots of focus on lesson learning. And that's exactly what happened next. So there was an external report from the National Audit Office. There was obviously an internal report from NHS England, so the lessons learned from WannaCry. And it identified 2 fundamental issues. Firstly, the failure to apply available patches on Windows systems, compared with the poor isolation of vulnerable services from the open internet, was the root cause of this. Yeah? That's what this came down to. But the other key thing was that the NHS as a system had not rehearsed for a national cyber attack. So it wasn't immediately clear who should lead the response, and there were significant problems with the resilience of communications which had not been thought through and pre-planned for. So whilst there was lots of good practice at individual hospital trust level, nationally the system did not work as it should have done. So there was a long list of lessons learned in the UK, which basically boiled down to have a plan, keep it up to date, ensure that you have resilient communications, and make sure that cybersecurity is led by and kept on the executive board agenda. Okay? And all of these things are, of course, fundamental, basic business continuity practice. It's important to note that this was a ransomware attack and that no party within the NHS paid a ransom. Okay? The advice from GCHQ, or National Security Service, of which the National Cyber Security Centre is a part, is never pay a ransom on a ransomware attack, because you have no idea whether you're going to get your data back or not, and it might just expose you to further attack going forwards. But outside of the wider system, there were specific findings around emergency response. So this was about 4 core areas. So ownership of response and incident response protocols. So cyber response is now led by NHS England, EPRR, so Emergency Preparedness, Resilience and Response teams, because they are the most operational department. So that's who leads the UK's response to a future cyber incident, which is not a case of if, but when. Within each trust, senior leadership and board level accountability has been mandated, including the availability of on-call IT support expertise. If you want to have a response on a Friday evening over a bank holiday weekend, you've got to have that response available. Also, testing. There is now a requirement to do annual cyber testing, and as part of that, to test alternative communications channels. In terms of assurance, all trusts are now mandated to make sure that their supply chain, particularly in terms of diagnostic equipment, is reviewed and resilient, and there are, in contracts with diagnostic test providers, formal agreements about how machines are going to be kept up to date with the latest software and security patches. And that's been baked into contracts going forward. And then, of course, there's been a huge focus on developing new standards and making sure that we invest in the key areas of risk. Okay. So what does the new normal look like? Well, the new normal is much more focus on data security standards. A bonfire of the fax machines, according to our Secretary of State for Health, getting rid of old redundant technology, which ironically, of course, is perhaps the only resilient part of your communications network during a cyber attack, however. And then we have a huge focus externally on the General Data Protection Regulation, so EU law that we now have to comply with from a data security perspective. But the NHS in England has also launched the Data Security Protection Toolkit. So this is like a set of standards. It's an Excel spreadsheet which runs to 7 sheets of detailed requirements, which trusts have got to implement in full by the end of March 2019. As you can imagine, there's a huge focus on this. But it's a focus not just by NHS trusts, but also by the wider supply chain. So universities collaborating with the NHS on research, for example, now have to comply with the Data Security Protection Toolkit if they wish to use and receive NHS data as part of their research. Because, of course, keeping patient data safe is not just an issue for the NHS, but also for everybody else that processes NHS patient data too. So what's happened since the cyber attack? So the Department of Health and Social Care has spent something in the order of £60 million immediately to secure local infrastructure. So that was focused primarily on ambulance trusts and mobile mobilisation apps. It signed a Windows 10 licensing agreement with Microsoft. It's agreed a further £150 million worth of investment over the course of the next 3 years. It's procured a 3-year deal with IBM to have a new cybersecurity operations centre to boost response. It's launched this data security protection toolkit. Trusts are now hiring dedicated data risk managers to manage this agenda. There have been a whole suite of on-site security assessments, and indeed there is now work with the Care Quality Commission to do unannounced inspections with NHS Digital to check that trusts have really implemented the data security standards. And many trusts have now rolled out advanced threat protection. So 130 trusts have now rolled that out so that their systems are routinely scanned for malware, for phishing, and that they are blocked early on by this software. And critically, trusts have now, all of them, identified a board member responsible for data security and cyber preparedness. So every single trust now has a top executive leader responsible for this agenda. So, are you ready in Hong Kong? Catherine has described what it looks like when you don't have access to IT. Imagine if all of that is unavailable. Your patient observation and medical history, clinical supplies and ordering systems, prescriptions and allergies, diagnostics and medical imaging, treatment regimes, and clinic lists and staff rotas, all supported by an unavailability of email in order to communicate. Would you be ready to respond to this if it happened tonight in your hospital? So how do you go about operationalising a plan with IT? So you need to make a joined up plan with IT. And it's worth noting that IT can, and quite often is, very disconnected from clinical reality. Yeah? It's really important that you talk to them and stand your ground and explain why it's not acceptable to take down a system at 8 o'clock on a Monday morning when you need access to it because it's a period of peak demand. Yeah? So you need to think about talking to IT about how you are going to deal with and manage patient information backlogs. So if IT does go down, how are you going to restore all of that data? Do you have a mechanism to do it? Are you going to scan it? Are you going to data entry it? Do you have staff available to do that? Are you going to keep stuff in hard copy? What's the clinical risk if you're doing that? The message throughout today has been about improving routine downtime procedures. And if you can improve those routine downtime procedures, you will improve your response to something significant like this. Do you know what the hospital IT disaster recovery plan is and what the restoration timeframes are for critical applications? Do you know where they're backed up? Do you know where they're stored? Has IT done a test of the disaster recovery restoration? And have you signed that off as clinicians to make sure that the data's really there when they do restore from backup? And do your business continuity plan workarounds actually reflect the impact of downtime? Do your staff, all of your staff, including bank and agency staff, know how to respond in the event of a serious cyber incident taking down your IT system? Okay. So I'm going to leave you with some top tips for working with IT leadership. First and foremost, focus on your key assets and your key areas of risk. What is the most important stuff to you clinically? Make sure that IT have got that clearly in their minds. Secure legacy systems. Yeah? If you've got old versions of software running, which is really important to you, make sure that that's kept up to date, that it's patched. Those will be your key areas of vulnerability. Yeah? And test your backups. Yeah? Make sure that IT are automating the awareness of deviations. So if your systems are under attack from phishing emails, that they very quickly pick them up and work to block them. Yeah? If you've got staff trying to access systems out of hours, or your Hong Kong systems are being accessed suddenly from an IP address in North Korea, well, it should be being picked up by your awareness of deviations, okay? And you should be looking to block those with advanced threat protection. Share information. Collaboration is incredibly important. And down the right-hand side there are a number of information sharing forums that are incredibly important in the UK context. No doubt you will have similar here in Hong Kong. In order to be responsive to cyber incidents, you need to know that there's an incident going on. So make sure across your hospital system, if something is going on, that it is shared across the system and quickly to enable people to be able to respond. And get the basics right. So educate your users and your executive team. Make sure that overall you increase readiness. Apply patches promptly and systematically and comprehensively. Okay? Make sure that standards are enforced. So that's both identity and access controls, but also password protocols. The new guidance from GCHQ in the UK is at least 17 digits, including upper, lowercase, and special characters and numbers. Yeah. But the advice is that you don't need 17 different passwords. You just need one strong one. And then you need to monitor it on sites like haveibeenpawned.com to check that it's not being compromised. Okay? And you need to risk assess and work closely with audit. Get external experts to come in and make sure that you are regularly doing penetration testing of your sites to pick up on vulnerabilities. It'll expose a lot. And make sure that your incident response process works at a system level and at a trust level. Make sure you've got 24/7 response capability. If you haven't got a cyber incident response company on speed dial to help you, make sure you know where you're going to go, either linking in with national capabilities or linking in with other expertise. Think about your supply chain vulnerabilities. How many of your devices in your hospital may well have 0000 as a password? Or 1234? Or the password? Because if they do, they're going to fall over really fast. Okay? So, the key thing in the UK has been implementing and verifying that national guidance has actually been implemented and is working, and that this agenda is led by board members to make sure that it stays high profile. We are not able to stop cyber attacks, but what we are able to do is to make sure that we are a hard target. And as businesses invest more and more in cybersecurity, if the health and social care system doesn't also invest, we will be left behind and we will be the low-hanging fruit that is easy to attack. None of us want to be in that position because of the horrendous impacts that it has on patients. So thank you very much indeed.